I have in front of me a Suicide Fatality Review Committee report that was submitted to the state, I understand. Talk to me about this committee and why it is so important.
Well, Governor Duane put it into state statute that communities could form a Suicide Fatality Review Committee, and the Mahoning County Commissioners, took action. They named the health commissioner, the county health commissioner, myself, the sheriff, and the coroner to this committee. And we review trends, we review suicides that have been completed, and it's not to blame anybody, it's to look and see, was there something missed? Was there something we should have caught, something we should have seen to prevent a future suicide? And, as I mentioned earlier, many of the people that review actually have gone to their doctor prior to the suicide. And so I think that's why we're working very hard to let families know you need to start the conversation.
If an individual says these words to their primary care or the other caregiver, are they required to do any type of reporting or just refer that individual to the services that are available in the community?
Well, if a doctor or if a policeman or a health officer would think somebody was at risk to themselves or others, they're required to do something. But most of the people going to the doctor will spend time with them, maybe make an appropriate referral, have them call 988 and talk to somebody. Talk to the family members. There's things families can do. If they're concerned, they can call the police, they can call their doctor. The most important thing is do not leave the person alone. Stay with the person.
I've also noticed, Duane, and I don't know if you can speak to it or not, but there are now notifications on certain medicines that says may cause.
Right.
And they leave that open. The pharmacist's role in any of that?
Well, I think the important thing with the pharmacy too, they keep track of people's medications, so you can't go from one pharmacy to another. Right. And I think there's a warning signs, but I think pharmacists also spend some time. But families are getting more and more educated, and doctors are getting educated, so I just think, again, it's just important for family members to look at the sheets that come from the pharmacy and look at it. And again, for the family member, if they notice a change in personality, a change in mood, someone drinking more, somebody, becoming angry.
They'll voice it in one way or another, whether it's silent or verbal.
Right. It could be they withdraw or they become very angry and they didn't. Giving away possessions or things like that. If you see these, as I said, start the conversation. You need to say to the person, are you thinking about harming yourself? And
before we leave this segment, the number again to call?
The number to call is 988.
Very important. We want to make sure that message is given. We're going to continue this in-depth look at what's happening in our community that affects us all one way or another. I'm Dee Crawford, Community Affairs Director, WKBN.
Hi everyone, I'm Lindsay Watson. Thanks for watching the WKBN 27 First News YouTube channel. If you want more video news, subscribe to our channel. And don't forget to download the WKBN 27 First News app for breaking news alerts.